Obsessive-compulsive disorder, or OCD, is a mental health condition. It involves recurring unwanted thoughts, known as obsessions, which can cause significant distress. People with OCD often feel the need to perform repetitive behaviors, called compulsions, to reduce the anxiety caused by these obsessions. It's important to remember that OCD is a treatable condition. With the right help, individuals can manage their symptoms and live fulfilling lives. Imagine constantly worrying about germs. You might wash your hands dozens of times a day. This is just one example of how obsessions and compulsions manifest in OCD. Obsessions are like unwanted guests in your mind. They keep showing up uninvited. Obsessions can take many forms. Some people have intrusive thoughts about harming themselves or others. Others may experience intense doubts about their relationships or decisions. These thoughts can be very frightening and distressing. It is crucial to remember that having these thoughts does not make you a bad person. They are simply a symptom of the condition. Compulsions are the actions people with OCD feel compelled to perform. These rituals are an attempt to neutralize the anxiety triggered by obsessions. For instance, someone with contamination fears might engage in excessive cleaning. They may avoid touching surfaces or wash their hands until they are raw. While compulsions may provide temporary relief, they can become extremely time-consuming and interfere with daily activities. Individuals with OCD often recognize that their obsessions and compulsions are irrational. However, they feel powerless to control them. This can lead to feelings of shame, guilt, and isolation. OCD can significantly impact various aspects of a person's life. It can affect their work, relationships, and overall well-being. The time-consuming nature of compulsions can make it challenging to fulfill work obligations or engage in social activities. For example, a person with OCD related to orderliness might spend hours arranging objects, leaving little time for other essential tasks. This can lead to problems at work or school. Relationships can also suffer as loved ones may struggle to understand the individual's obsessions and compulsions. The constant battle with intrusive thoughts and the need to perform rituals can be emotionally draining. Individuals with OCD may experience high levels of anxiety, stress, and even depression. They may withdraw from social situations and avoid activities they once enjoyed. It's important to remember that OCD is not a sign of weakness. It is a real medical condition that requires professional help. With appropriate treatment, individuals with OCD can learn to manage their symptoms and live fulfilling lives. Section 4. Exploring the roots of OCD, a multifaceted perspective. The exact causes of OCD are still not fully understood. However, research suggests that a combination of factors likely plays a role. These factors include genetics, brain chemistry, and environmental influences. Studies have shown that OCD tends to run in the families. This suggests a genetic component to the disorder. Researchers believe that multiple genes may be involved. These genes may influence the brain's regulation of serotonin. Serotonin is a neurotransmitter that plays a role in mood, anxiety, and compulsive behaviors. Brain imaging studies have revealed differences in brain activity and structure in individuals with OCD compared to those without the disorder. These differences may affect how the brain processes information related to fear and anxiety. Furthermore, environmental factors such as stressful life events, childhood trauma, or infections have been linked to the development of OCD in some individuals. Section 5. Seeking help and diagnosis. Recognizing the signs of OCD and seeking professional help is crucial for effective management. If you are experiencing persistent intrusive thoughts or feel compelled to perform repetitive behaviors that interfere with your daily life, it is essential to reach out to a mental health professional. The diagnostic process typically involves a comprehensive evaluation. This may include a physical examination, a review of your medical history, and a psychological assessment. During the assessment, the mental health professional will ask about your symptoms, their severity, and how they are impacting your life. They may use structured interviews or questionnaires to gather information and make an accurate diagnosis. It is important to be open and honest with your healthcare provider during this process. Provide detailed information about your experiences. Remember that there is no shame in seeking help. Taking this step toward understanding and managing your OCD is a sign of strength and a commitment to your well-being. Section 6. Cognitive Behavioral Therapy, a path to reclaiming your life. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that has been proven highly effective in treating OCD. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to the disorder. It helps individuals understand the relationship between their thoughts, feelings, and actions. Exposure and response prevention, or ERP, is a specific CBT technique used to treat OCD. ERP involves gradually exposing individuals to their feared situations or objects, known as exposure, while preventing them from engaging in their usual compulsions, known as response prevention. For example, someone with contamination fears might be asked to touch a doorknob without immediately washing their hands. Over time, through repeated exposure, the individual learns that their feared consequences do not occur. This helps to reduce anxiety and break the cycle of obsessions and compulsions. Section 7. Finding hope and support in the journey with OCD. While the journey with OCD can be challenging, there is hope for recovery and a fulfilling life. With appropriate treatment, individuals can learn to manage their symptoms and regain control. Alongside therapy, certain medications, such as selective serotonin reuptake inhibitors or SSRIs, can be helpful in reducing OCD symptoms. SSRIs are a type of antidepressant that works by increasing serotonin levels in the brain. In addition to professional help, several support strategies can be beneficial for individuals with OCD. Joining a support group can provide a sense of community and understanding. Connecting with others who share similar experiences can reduce feelings of isolation and offer valuable coping strategies. Practicing mindfulness techniques, such as meditation or deep breathing exercises, can help individuals become more aware of their thoughts and feelings without judgment. This can be helpful in managing anxiety and reducing the intensity of obsessions. Engaging in relaxing activities like spending time in nature, listening to music, or pursuing hobbies can provide a much-needed respite from the challenges of OCD. Remember, you are not alone in this journey. Recovery is possible, and with the right support, you can live a meaningful and fulfilling life. If you liked this video, please like, share, subscribe to the channel, and follow other interesting videos. Thanks.